Welcome to our Thursday, May 21st, 2:30 public update. In a moment, I'll turn it over to IDPH Dr. Ngozi Ezike for today's medical update. We've had tremendous rains lately, I think many of you know, and they have caused flooding in various places across Illinois. And therefore, this morning, I issued a state disaster proclamation to support Grundy, Pike, Scott, and Morgan counties in their fight against floods. And I've deployed 60 Illinois National Guard members to assist the hardest hit communities in those counties. The Illinois Emergency Management Agency and the Illinois Department of Transportation are already on the ground assisting local authorities, and along with the National Guard are operating with new protocols due to the pandemic. For example, the guardsmen and women are being tested for COVID-19 prior to deployment, and they're receiving PPE to wear when they can't maintain social distancing on the job. I urge all of our residents in these areas to be proactive and take precautions. Please be prepared and stay safe. And I want to express my genuine gratitude to the National Guard's citizen soldiers who are on their way to assist their fellow Illinoisans. This is on top of the hundreds of guardsmen and women who have provided vital capabilities to our state's COVID-19 response, and to our emergency management and transportation personnel who put themselves in harm's way to fight the floods and COVID-19 in those local communities. These folks are the best of the best, and all Illinoisans take pride in their bravery and their excellence. So thank you, and now I'd like to turn it over to Dr. Ezike for today's medical update.
Good afternoon, everyone. Let me start off by announcing that this week, again, I'm a few days late, the Illinois Department of Public Health is celebrating National Emergency Medical Services Week. And we want to recognize the important contribution and dedication of the paramedics, police, firefighters, and other first responders who provide day-to-day life-saving services. Emergency workers are willing to put their lives on the line every day to help protect the health and safety of their communities. I want to thank all of these brave men and women and recognize both their courage and their dedication, especially during this pandemic. Please join me all in recognizing our emergency workers during National EMS Week. And now to the medical report. Today, we are reporting 2,268 additional individuals who were diagnosed with COVID-19. We now have a total of 102,686 confirmed cases throughout Illinois. Since yesterday, unfortunately, we received a report of 87 additional lives lost for a total of 4,607 fatalities. A total of 672 tests have been run, with 29,307 tests being reported in the last 24 hours, our highest total to date. As of last night, 4,107 individuals were in the hospital with COVID-19, and of those, 1,088 patients were in the ICU and 609 patients were on ventilators. We have been talking about this novel coronavirus for months now, and we have learned a lot, but there are still unanswered questions. We have learned that people infected with the virus can spread it to others even a few days before they start feeling sick. There are instances where people who do not have any symptoms, or the symptoms are so mild that the person may not seek or need health care. However, a person who is asymptomatic can potentially still spread the virus, which is why testing is so important. So there are still questions we don't have answers to, such as, after a person is infected with the virus, are they immune? Can they get infected again? If a person is infected, can that person's blood or the plasma from the blood, can that actually be used as treatment for others? We are still learning the answers to these questions and many, many more. We're trying to learn them as quickly as we can, but we must use what we do know to be true to help protect ourselves and stop additional spread. And what we do know are the same things we've been saying from the beginning. Social distancing does work. We now know that wearing a mask can actually help prevent the spread of the virus, and washing your hands can prevent not just coronavirus, but so many additional viruses and other pathogens as well. Let's take it slowly. As we go into phase 3, as we continue to learn about the virus, we want to move towards continuing the reopening, but we need to do it in a smart way and in a safe way, and that means following the science. Thank you. And now I'll repeat comments in Spanish. Buenas tardes a todos. Esta semana, el Departamento de Salud Pública de Illinois celebra la Semana Nacional de Servicios Médicos de Emergencia y queremos reconocer las importantes contribuciones y dedicación de los paramédicos, la policía, los bomberos y otros primeros responderos que sirven nuestras comunidades. Los trabajadores de emergencia están dispuestos a arriesgar sus vidas todos los días para ayudar a proteger la salud y la seguridad de sus comunidades. Quiero agradecer a estos valientes trabajadores y reconocer su valor, tiempo y dedicación, especialmente durante esta pandemia. Únase a mí para reconocer a nuestros trabajadores de emergencia durante la Semana Nacional de EMS. Hoy informamos 2,268 personas adicionales con COVID-19 está reportado. Ahora tenemos un total de 102,686 casos confirmados en Illinois. Desde ayer, 87 personas adicionales con COVID-19 han muerto, para un total de 4,607 muertos. 29,307 pruebas hechas fueron reportadas en las últimas 24 horas. Hasta anoche se informó que 4,107 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 1,088 pacientes estaban en la unidad de cuidados intensivos y 609 pacientes estaban en ventiladores. Hemos estado hablando sobre este nuevo virus por meses y aunque hemos aprendido mucho, todavía hay preguntas sin respuesta. Hemos aprendido que las personas infectadas con el virus pueden transmitirlo a otros un par de días antes de que comiencen a sentirse mal, si tienen síntomas. Hay casos en que las personas no tienen ningún síntoma o los síntomas son tan leves que la persona puede no buscar o necesitar atención médica. Sin embargo, una persona asintomática puede transmitir el virus. Eso es porque las pruebas son muy importantes. Pero todavía hay preguntas para las que no tenemos respuestas. Por ejemplo, después de que una persona se infecta con el virus, ¿son inmunes o pueden volver a infectarse? Si una persona está infectada, ¿se puede usar la sangre de esa persona como tratamiento para otras personas? Todavía estamos aprendiendo sobre el virus lo más rápido que posible, pero debemos usar lo que ya sabemos que es cierto para ayudar a protegernos y detener la transmisión adicional. El distanciamiento social funciona. El uso de una máscara puede ayudar a prevenir la transmisión del virus. Y lavándose las manos para prevenir muchas enfermedades diferentes, aparte de coronavirus y coronavirus también. Vamos en rumbo a la fase 3, pero todavía tenemos que seguir con cuidado. Si lo hacemos bien, nuestro futuro será más brillante. Gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. I'll keep it fairly brief today, but there are a few pieces of news that I'd like to announce. I'm proud to share that Illinois has received an additional $1.3 million in Family Violence Protection Act funds through the CARES Act, allowing us to provide additional holistic services for domestic violence survivors and their families as we work to see all of our residents through this pandemic. This is in addition to the more than $1 million of additional state funding to support those who've experienced domestic violence that I announced earlier this month. Thanks to the creative team at the Illinois Department of Human Services, Illinoisans experiencing domestic violence now have greater access to alternative housing initiatives, transportation assistance, food, and supplies. Of course, we couldn't do this work without the assistance of the many local shelters and service providers that play such a critical role in their communities. Earlier this month, I was joined at our daily update by the executive director of APNA-GAR, which focuses on serving domestic violence survivors in immigrant communities in Chicago and the suburbs of Cook County. And there are dozens of organizations across Illinois ensuring that all of our residents can find the help that they need. Places like Sojourn Shelter here in Springfield, the Center for the Prevention of Abuse in Peoria, and the Cairo Women's Shelter in Southern Illinois, and A Safe Place serving Lake County and Northern Illinois. To access counseling and advocacy, legal assistance, and children's services, or to find a shelter near you, please call our 24-hour Illinois Domestic Violence Helpline, 1-877-2-END-DV. That's 1-877-863-6338. These services are free and completely confidential for all residents. I also want to let everyone know that yesterday, the most recent round of funding from the Illinois COVID-19 Response Fund, over $6 million, went out to 31 nonprofit organizations all across Illinois. The fund has raised more than $30.5 million, and that's all just since the fund was launched on March 26th, less than 2 months ago. I want to offer my gratitude to each and every one of the 2,800 donors who made that possible. And while I can't list out each and every name, let me specifically recognize some of the fund's lead donors: the Bloom family, Joe and Rika Mansueto, the Staines family, the Crown Foundation, State Farm, Caterpillar, Exelon Corporation, ITW, Northern Trust, and the MacArthur Foundation. In total, over $16 million of those funds are already delivering much needed support to Illinoisans, with 62 unique organizations receiving direct assistance. And because many of these are umbrella organizations that have distributed funds to smaller groups in their communities, the Response Fund has reached nearly 800 unique organizations to date. It has been incredible to see so many Illinoisans and Illinois companies willing to give to their neighbors in these trying times, and more so to see the vast network of nonprofits and volunteers who are on the ground serving families and helping them stay on their feet. From the Boone County Community Foundation to the Catholic Charities of Southern Illinois to the United Way of Greater St. Louis and countless others, the people of Illinois prove themselves to be the kindest and the most generous people in the nation. So thank you, and now I'd be happy to take any questions from members of the media.
We'll start with Amanda, Greg, and then go online.
Great.
Thank you so much, Governor. Hope you're doing well.
Thank you, and
quick
you.
question there. Did you get a COVID test before you came to Springfield after you had been isolating?
I did not. I was tested before I was isolated, and because I isolated the entire time right up to the point where I came to Springfield, I didn't get another test.
One of the measures that the General Assembly is working on is this vote by mail, so several questions there. I'll try to group them together. For one, does it go far enough? This would merely be mailing to people who voted in recent elections applications for vote by mail. You had wanted actual ballots mailed. So does it go far enough? And then on the opposite end, some Republicans are saying that this could lead to ballot stuffing. So how do you ensure the validity of this, particularly that President Donald Trump has raised questions about voting by mail?
Well, this has obviously been a Republican strategy all across the country to deny people the ability to actually go to the ballot box or to deliver their ballot to vote. Republicans, generally speaking, have been in favor of suppressing the vote all across the nation. They think it's bad for them if more people vote. I think everybody has the right to vote. We live in a democracy. The vote is sacred. And so I'm very much in favor of making sure that everybody gets a ballot who is eligible to vote and then returns that ballot.
So does this go far enough?
In my view, I would like more done. And of course, this has been a discussion, a negotiation, conversation, better said, about how to make sure that the most people get it and that, we're doing the best we can with the resources that we have.
So
allowing people, to sending out ballots, or rather applications to everybody that voted in the last number of elections, and still giving everybody else the ability to apply to get a ballot, I think is a reasonable compromise and gets us what we want, which is people don't need to go to a physical balloting location. And you see, by the way, that there are other aspects of that legislation that do provide easier access to the ballot box for people who do need to go in person and may want to in the days and weeks, indeed more than a month and a half or about a month and a half before the election.
Concerns about Illinois losing federal funding, giving threats by President Trump regarding states that do proceed with expanding vote by mail. Is that a concern? And this is from Mark Maxwell. Jumping off of that, you have made similar threats to local governments in terms of holding up funds from the state if they don't comply with your executive orders. So why might it be bad when the president does something like that, but okay when you do it?
Well, there's an awfully big difference. The president is threatening to take away funds from states doing something that's legal. And what we were talking about, as you suggest, in the weeks before, about the possibility of holding up funding for local governments because they're not following the law, that's a much different thing. But look, I think it's very important for people to get access to the ballot. The president doesn't want that. I do want people to get a ballot and to vote, and that's just an enormous, enormous ideological difference. I believe in democracy and the right to vote.
Coming from Rick Pearson of the Tribune, the Republican delegation to Congress has sent you a letter that wants to know more about what Illinois is doing as it allocates federal funding that it has received for the coronavirus response that was appropriated recently, of course, under the CARES Act, citing a report from the National League of Cities that says Illinois is a state that is withholding funding from municipalities.
No funding is being withheld at all. We need enabling legislation. We needed the legislature to actually get together to provide that enabling legislation, and that's what's happening over the next day and a half.
I know that there were a lot of folks who rejoiced about your announcement yesterday, and yet a lot of questions. So I'm going to try and rapid fire these from news organizations. For starters, that Mayor Lori Lightfoot in Chicago has said that restaurants in the city are not going to be able to open restaurants by the end of May. What is your response to that? And does that underscore complaints, particularly from leaders in the collar counties and the suburbs, that they have been unfairly lumped in with Chicago?
Well, the decision by a municipality like Chicago to not have outdoor seating is completely up to them. As I've said all along, we've tried to provide a baseline to protect people in various communities, in different cities and counties. They can do something that's more stringent and decide not to allow certain activities because maybe they're a hotspot, maybe they're concerned about something in particular that they want to deal with on a local level. But I think many towns, cities, and counties across the state will, in fact, be having outdoor seating for restaurants, and those that choose not to, that's a completely local decision.
And you did ease up on those restrictions, obviously, from the original Restore Illinois plan. Mm-hmm. Again, we're still hearing a lot from those suburban leaders in Collar County executives that are saying, why are we part of Cook County in Chicago? So do you have any plans, any second thoughts as to whether that might change?
That's not something that I'm looking at doing, and we have 4 regions. They've all been moving in the right direction. You see that everybody in Illinois now, all 4 regions, are not only moving in the right direction, but are going to be able to, barring some catastrophic thing that may happen in the next 8 days, will move into the next phase.
Flock Club wants to know more about how people can safely meet in these 10 groups of fewer. Should it be the same 9 people that those can see, or can we, for the next phase where we're allowed to gather with 10 people or more, does it have to be the same 9 people? Do we need to still wear masks? Can people hug and touch?
Maybe I missed the first part of your question. In a specific circumstance?
In this next phase,
Yes.
where the
10
gatherings
or
of 10,
less.
I think people have a lot of questions as to how they can do that safely, comply with the law.
Yeah.
So for example.
Yeah, it's about social distancing. I'm sorry to interrupt if there's
No, go
more. It's really about social distancing, wearing face coverings, making sure that you're keeping everybody safe that's with you. That's really the goal here. We want people to get together to enjoy themselves. Remember, in the phase that we're in now, in phase 2, we don't have just anybody meeting in groups of 10 or less, right? It's meant for essential workers or in other circumstances that are required. But in the next phase, really any group of 10 people can do it. But again, the idea here is to make sure that we have safety is an uppermost concept in people's minds when they're getting together. Wear a face covering, keep social distance from one another, and outside is always the best circumstance.
Cisco Cotto from WBBM News Radio follows up with that, saying that retail stores are going to, in phase 3, be able to reopen with capacity limits. There are, of course, large places of worship. Will they be able to observe capacity limits in phase 3 as opposed to the restriction of 10 people or fewer?
Well, again, capacity limits are intended, we're still in a phase where 10 people or fewer is the desired number. That's what the epidemiologists are recommending and so on. Many small stores, that is a number that may be less than they normally have in their store, but it's still a reasonably good number, and they can keep track of people who are coming in and out, and those who can't fit in can certainly socially distance outside as they wait to go in. With regard to churches and mosques and synagogues, I think it's important for people to be able to get together and worship, but again, we've got to follow the same rules. The whole idea here, this isn't something that I made up. This is something that the epidemiologists really have emphasized, that until we know whether having larger groups together, and what the effect of that is, we need to watch what it's like when we let everybody get together in a group of 10, in groups of 10, even with social distancing. We don't really know, right? And what you're doing is watching, and that's why you have a phase, right? We're watching week by week, day by day, through the phase to see what's the effect on the number of people who are coming down with COVID-19, the number of people who end up in a hospital. And you'll see as we move forward, we'll provide you with more data, but you can see it yourself if you go to the DPH website, that it takes several weeks for these things to work through. Groups of people get together and they do something that they shouldn't have done, and someone spreads it in a group. You don't see an immediate effect. 2 weeks later, you start to see maybe people are entering the hospital, more people are entering the hospital, and then perhaps 2 weeks later, you're seeing people going into the ICU and perhaps on a ventilator. And even a week after that, perhaps people dying. And so that's why we're trying to, take a gradual approach here to all of this.
Today, the Illinois Department of Employment Security came out with new figures, pretty awful ones, regarding the number of people who have lost work last month, and yet there continue to be issues with IDES and filing for that. Elizabeth Matthews of Fox asks about someone who was given a runaround as they tried to receive pandemic unemployment assistance, that a caller hung up. So are workers properly trained for this, or was training at all rushed? And can you address as well just the general high figures of unemployment?
Yeah. Let me start with just saying that this is a tremendously disturbing problem that everybody in the country is facing. The high unemployment, the number of people who have been furloughed, laid off, perhaps permanently, the number of businesses that, especially small businesses, which are really the lifeblood of job creation in our country, right? Those small businesses, when they close up, it's hard for them to restart. And it's a tragedy that requires us to really put shoulder to the wheel to make sure that not only the federal dollars that have been provided through PPP, but also the state COVID relief effort is working to revive employment and revive small businesses and to get people back to work. That's certainly an extraordinarily high priority for me. As to people who are experiencing problems connecting with unemployment, and I know the PUA system, as you mentioned, look, there are going to be these circumstances. There have been. It's not, it's not something that's not excused in any way. It is something that when, we have these rush of applications that come in a single day, the number of people answering the phone, there's only a certain number of people who can, and then things are going to happen. I mean, there's no doubt that mistakes get made. If somebody gets cut off the phone line, it's not because there's somebody on the other end who's saying, I don't really want to do that work, and hitting a button. That's not what's happening. I mean, you should see these IDES employees. There are people who are, who are yelling at them because they're angry about their situations, but the IDS employees are working so hard to try to get the job done. And I just want you to know that for people who are continuing to have difficulties, please keep trying. We've been doing our best to expand the ability both to take phone line calls as well as online applications.
When it
Amanda,
comes
we'll
to,
let you do one more and then move to Greg.
I've got
two.
budget and contact tracing questions. So, and actually a follow-up as well too, in terms of unemployment, lots of questions about childcare. Can somebody receive unemployment if they are not able to find childcare, or what are we doing? I know you've talked about expanding childcare, but people are still saying they're having access issues.
Yeah, you mean, can they get childcare if they're on unemployment? Is that your question?
No, if they are unable to find childcare,
Uh-huh.
can they continue to receive unemployment? There are those who say that they are fearful that they won't be able to go back to their job because they have nowhere to send their children. Then therefore, what do they do? Quit?
Right, so that's one of the things. Number one, as you know, we created emergency licenses, and we've licensed more than 2,500. I think we're at about 2,650 or more emergency childcare locations. Remember, you have to back up just a second. This isn't a desire on any of our part to limit childcare. The idea here is that with everything that we know, especially the potential that there are COVID-related illnesses that can befall children, that we want to make sure that we're also limiting the social interaction, the numbers of people that are in a childcare setting, both the children and the adults. And so this is obviously a difficult circumstance when you think about most childcare facilities have many more than 10 children. They may have 15 or 20 in a space, and then they have multiple spaces, and they often are, running into each other in the hallways under normal circumstances. So when when we have a pandemic and a mystery, that is COVID-19, that we're all trying to unravel, and we're trying to protect people, we've got to move to what's the best way to protect them. And so moving to these emergency 10-person, 10-child facilities has been the best thing to do. Now, we also need much more childcare. And so we're working with childcare providers. It's a long answer because I really believe,
You see how you looked at me?
understand, I really believe in providing childcare for families. This is, it's something I've worked on a long time, and I've been expanding into the state of Illinois before COVID-19 came along. So it's something I believe in. So we are working with childcare providers to try to figure out how in their facilities where we've only said you could have 10, is there a way to keep children separated in groups of 10 without having the kind of interactions that you normally would have in a childcare facility between all the people, the teachers that are there, the childcare providers, and the children themselves. So we're working on it. We have a task force of childcare providers who are motivated, trust me, to want to open their facilities, and I am motivated because I know as we get people back to work, they need more childcare. So we've been at this for some time. Suffice to say, my deputy governor and my first assistant deputy governor are on top of it and working with this task force to make sure we expand it.
I have two topics to cover. I know Greg and I spoke beforehand to try and make sure that we covered all the bases of the many questions we're getting from journalists throughout the state. So one of them is about contact tracing. I'll group those together as well. The first is Apple and Google are now out with apps that have these abilities to do some of that contact tracing work. So can you respond to that, particularly given Illinois biometrics laws and limitations, fears about breaches? And just in general, you've made an announcement, I believe it was Monday, regarding pilot programs. We've had coronavirus in the state of Illinois for 4 months now. So what good is contact tracing at this point where we've hit 100,000 cases, 100+ counties? Is it too little too late?
Well, let's start with no state has.
We are going to kind of get on the road pretty quick. I got a granddaughter. I'm going to be at her graduation tonight, so we got to head out here pretty quick to get to that. So I just want to give everybody a little heads up why I'm going to be walking out of here when this is over. As I have said many times this week, COVID-19 testing will continue to be a major priority as we move forward. We cannot fully recover economically without increasing our testing numbers. We have made great progress over the past month in regard to testing, but we must do more, much more. Time and time again, I have said that we make our decisions based on Missouri-specific data. The more testing we do, the more data and knowledge we have on the situation in Missouri, and more confidence and reassurance we can give Missourians as we work through the recovery process. As I said earlier this week, I have set a goal of reaching 7,500 tests per day. The plan focuses on 3 main testing strategies: box-in outbreaks, Sentinel testing, and community sampling. We have already been utilizing these strategies, and we will ramp them up even further next week. First of all, let me talk about the box-in testing. The box-in strategy will focus on congregated living facilities, specifically long-term care facilities, with a daily target of approximately 1,850 tests per day. We have a total of 163 long-term care facilities that have had a positive case, either a resident or staff or both. The goal with box-in testing is to go into these high-risk facilities where there has been at least one positive case and execute facility-wide testing. This will allow us to keep the virus contained by identifying and isolating additional positive cases as quickly as possible. Now, Sentinel testing. With Sentinel testing, our goal is to perform testing at state-owned facilities across 28 counties, specifically those overseen by the Department of Corrections, the Department of Mental Health, the Department of Social Services, and the Missouri Veterans Commission. Our testing targets for this strategy is approximately 1,440 tests per day over a 10-day period. By performing Sentinel testing in these facilities, we can identify and isolate not only symptomatic individuals, but also asymptomatic individuals to keep them from unknowingly spreading the virus within the facility. Community sampling. With community sampling, we will set up testing sites in different counties across the state. And anyone who wants to be tested will have the ability to do so. We have already completed community sampling in 13 counties. For this plan, we'll be targeting 6 additional counties over the next 10 days with a total daily testing goal of approximately 975 tests per day. In addition, we have also delivered 9,000 test collection kits to the St. Louis Region Task Force, with another 9,000 to be delivered next week to continue the broad community sampling. I want to point out that just because we come to your community does not necessarily mean that there has been a spike or outbreak in your area. The selection of these counties is based on locations with the ability to draw participants from a broader region and locations that have expressed a need for additional testing resources. By doing community testing, we can get a better idea of the prevalence of the virus in these areas, which will help guide our response and ease uncertainty for Missourians. If the prevalence is low, this will reassure citizens and businesses that it is safe to begin re-engaging in the community and returning to somewhat normal operations. If the prevalence is high, we can quickly and proactively keep the virus from spreading further in the community. Over the next 2 weeks, we will aggressively execute on these 3 areas: box-in testing, Sentinel testing, and community sampling to reach our 7,500 goal. I want to point out that our plan is based on what we can do at the state level to help jumpstart testing volume. Hospitals, healthcare facilities will continue their normal testing operations. Once our testing numbers are up, we will be able to reevaluate and determine what is needed moving forward. Again, I cannot emphasize enough how important testing is to the overall recovery plan. All 4 pillars of the recovery plan are important, but testing will be the key. The more testing we do, the more knowledge we have on what the situation in Missouri actually looks like, and the better equipped we are to move forward. To wrap things up today, there will be no briefing tomorrow or Monday. We will resume briefings on Tuesday, Wednesday, and Thursday next week to provide updates. As we move into the Memorial Day weekend, I want to again remind Missourians to be safe, to be smart, and to be responsible. We want everyone to enjoy the holiday, but we cannot let our guard down. As you get outside and spend time with family and friends this weekend, please remember to be cautious, and social distance should be a priority. Holiday or no holiday, this is still the most important step we can take to keep Missouri on track. Teresa and I want to wish everyone a happy and safe Memorial Day weekend. Thank you, and God bless. Kelly, let's open it up for questions.
Governor, this is actually on the economy and state workers, but is keeping state workers working remotely permanently or at least indefinitely part of a strategy going forward?
Yeah, I mean, we're reevaluating like everyone else does, other companies across the state, but we're bringing people back to work every day, but we're also going to look how do we do things more efficient and how we do better. If we can do things better now that we know remotely, that's fine too. But every day we're evaluating that situation, but we're bringing a lot of people back to work on a continuing basis to who needs to be here. But if we don't need them here right now and things are going well, remote, that's great. We'll just continue to do it.
Thank you.
Hi, Governor. You mentioned with the community testing, if there is a high prevalence, that we'd be able to put a stop to it pretty quick. Would that look like more restrictions, more like stay-at-home orders, or what kind of ways, if there is a high prevalence in a community sampling, what kind of ways would you?
Yeah, I think first we go back to what we're talking about today. We got to go in there and we got to test and see what we really got, and we got to evaluate that and see how widespread that is in a community. Or is it a certain area we can just address to that issue, where that might be. And let me just take, because there's been a couple of issues around the United States, I know, and one thing that concerns us, and I know as I talk to the clergy and the faith-based community, churches. Well, we have had a couple of instances across the United States and other states where churches come back and they had a little bit of a problem. So we need to keep all that in mind, but we'll be prepared to address that if it happens. So, but I don't think you're going to see a totally regional approach. You're probably going to be able to isolate it to where that issue is. And now that we have the testing capability and we kind of know what we know about the virus, I think we can do the box-in testing and kind of secure that pretty quick. I'm confident we can.
Thank you.
Governor, the CDC has released some guidelines for reopening schools. I wondered if that has given you a clearer picture of what the fall might look like, or is it still too soon to tell? Yeah,
I haven't seen the new CDC guidance on the schools yet. But what I'm hoping for is as things move forward, again, due to the testing, due to the information we have, the data, hopefully we're going to move school to where they start opening the schools up. We get back to some sort of normal function in the schools. However, I want to say this too, as we're moving testing, as I said yesterday, of the information I give you on testing, why it is also so important to do it now. is because that school season's coming, flu season is coming, and we're going to be in operations here in the next 4 or 5 months. So as much testing as we can do now, it prepares us for that season too, and that's critical for us to move forward. Because one thing, I think there's going to be some remarkable things done with some of the drugs that are out there, hopefully a vaccine. But right now, though, that's hopeful thinking, but I got to prepare that we don't have that. So that's what we're going to focus on. That's why we want to emphasize the testing so much.
Governor, do you have an estimate of the cost of these 3 different testing strategies? And then also, how's it being paid for? And are health departments at the local level or at the state level or both going to be doing this testing? Well,
First of all, I would say both, above, everything's on the table there. But here's the thing I think you need to remember. All the testing's pretty well right now going to be paid out of the CARES Act for the COVID-19. So there's a lot of money on the local levels for testing. That's what we're really emphasizing, that money they're sending out. So the local levels are going to be responsible for that too. The state's not going to come in and do their testing for them free. So if they have the funds and the resources to do it, whether it be the counties or the health departments, they're going to have to help with that. Number two, when we go looking at it kind of in the private sector, we're going around there, if the companies have the ability to pay for it through the insurance companies, they're going to have to pay for that also. So I think there's a number of things that go into place there. But look, I don't think anybody should be expecting the state to come in here and do this all for free when they have the capabilities to go through their insurance companies, or they have received COVID-19 funding through the CARES Act. They're going to have some responsibility on their own.
What about with like Kansas City, for instance? It's having a funding battle with the county. How is that going to work? Are you able to go in and help them?
Well, I think we'll help Kansas City, we'll help St. Louis, we'll help Poplar Bluff, we'll help Bolivar, Missouri, my hometown, wherever they need help. But we're not going to get in the middle of turf battles up there. That's an issue up there between the county and the cities and in that region. So again, I'm not sure that's my place to fight that battle. But look, I've said all along, and I've talked to the mayors weekly and talked to them, we are here in a support role to help them. And that's where the state role comes in. I don't think the state's here just to take over the local levels and tell them what to do and what not to do. We're here in a support role. We're going to continue to function in that manner. All right, thanks everybody. Hope everybody out here has a good weekend. I will see you next week. Thank you. Dr. Williams?
Thanks, Governor.
All right, any questions for Dr. Williams? Jeffrey?
Dr. Williams, good afternoon. Looking at the new dashboard, it appears that there were 30 new deaths, and yet there's like a daily tracking number that was different. It had a lower number. Were there 30 new deaths? Is that the biggest jump we've seen in one day?
Yeah, thank you for the question. And I think one of the things we try to point out is that with the deaths, even though they're supposed to be reported in 24 hours, that has not been the case. And so when you see a spike like that in one day, people always think that means 30 people died the previous day, and what was that all about? But often that will reflect a period of time. So we are dependent on that dashboard on when it's reported. So what I would really encourage you to do, even though we take great effort to be granular and give it to you on a daily basis, what I would encourage you to do is to look at 3- and 7-day trends for those. But to your point, 30 deaths are 30 deaths, no matter when they happen, and we lament all those, and it makes us very analytical as to why that is. Our number of cases for the last month, new cases, has hovered around 150, 140, but our deaths continue, and we know there's always going to be a lag between new cases and deaths of about 3 weeks. And so we think that's what we're seeing, is that sadly those 30 deaths represent new cases that were from 3 to 4 weeks ago. One of the things you see in this disease is that a large number of people who end up on ventilators pass away. And many of them, the average time they're on those ventilators can be 14 to 17 days. So, not to expand too much on your question, but it's why we think it's so vital what the governor's talking about. Because if you want to decrease those deaths, we truly think you have to move way upstream and prevent the number of cases. Our average age of death in Missouri is 77 years old. And so if you want to decrease that 30 number, you really need to move way upstream and decrease the number of 77-year-olds getting the disease. Because what we've learned from this is that once they're on a ventilator at that age, there's a very high morbidity and mortality.
Hi, Dr. Williams. Governor Parson mentioned different testing goals for like community sampling and testing those 6 different counties. What happens if you don't reach that testing goal by a significant number? How does that affect how you view the coronavirus in Missouri?
Yeah, I think the goals are there from a public health strategy of what we think we can do. Our goal is to do more testing, both for patients and for helping us with policy. So in those 3 buckets, that number really derives from the fact that we know we're almost up to being able to do 10,000 tests a day. And as the governor has said, and I've said, you know, it's like developing muscle. We've now got more than 150 mobile testing sites out there. We want to develop that going into the fall, and we wanted to have this capacity to test. So right now, if you look at our Sentinel testing, for instance, we will be doing in a very rhythmic way testing of nursing homes and meatpacking plants and long-term care facilities, all of those. So this isn't just right now. We're going to be doing this on an ongoing basis. If you looked at our boxed-in strategy, all 3 things have started already. We're in Andrew County tomorrow doing, I think, 500 tests as part of our surveillance. We're already in by Wednesday, we'll be in all 50 nursing homes doing our testing for the boxed-in strategy that have had 1 patient in the last 14 days. And we've already started our Sentinel testing in our state facilities. That started, I think, 2 days ago. So that number will just naturally happen based on our projections of how each of those parallel items, what we think, just based on how many state employees we have, based on our prevalence, and based on how many nursing homes we have. I mean, we know right now we have 9,000 people to test in those 50 nursing homes. We already know that. So that's kind of where that number comes from. And one thing, an earlier question, which was a great question, funding. I testified this morning before Chairman Fitzpatrick's working group. And we've received $135 million from the federal government for testing in addition to the CARES Act funding. So we will be spending some of the money on that. And as the governor said, we will also be developing other funding streams. I do want to put in a plug, is that I know the governor has been great. You know, that $500 million or so that went out to local counties has to be spent on COVID-related items, and certainly a huge part of that is our local health departments. And so we're greatly hopeful that the county commissioners will spend some of that money on testing capacity within their own county. So we have the $135 million we'll be spending from a state perspective, and some of that may be going out to counties. But we also very much want those counties to develop their own capacity, whether it's antibody testing or boxed-in strategies. So we're fortunate with that new funding from the federal government and the money we've sent out to have multiple funding streams to obtain our goal to do as much testing as we can here in Missouri.
Both in terms of the goal of 7,500 tests a day and also the numbers that are tracked on the website, is that strictly active case viral testing, or does that also include antibody testing?
No, it does not include antibody testing. About 4 states have gotten in a lot of trouble because they tried to conflate their numbers, I think, to drive up their numbers, and we don't do that here in Missouri. As I mentioned the other day, we've done about 13,000 serological tests through our commercial labs, but the numbers you see are just PCR testing by our commercial and state labs.
And then under any of these 3 strategies, if someone does test positive who didn't know they were infected, what's the system in place to support their isolation? Would they be sent home from work? Would they still be paid? If they can't go home, where would they go?
Yeah, no, that hasn't changed, is that all positives, whether serological or by PCR, are reported within 24 hours by law. And the health department will then go out and talk to them. They will isolate them, and then they will do contact tracing. So in all of our strategies, whether it's prevalence, Sentinel, or boxed in, that component remains the same.
So they would be sent home and be isolated there?
Yes, they will be isolated, yes, if they're positive. And normally, the guidelines have changed on that, but normally that would be 10 days from when they tested positive and they had been asymptomatic for a period of time.
Thank you.
You're welcome.
Hi, Dr. Williams.
Yes.
You spoke a little bit yesterday about the remdesivir, so
Yes.
just curious about an update on that from, where did that go?
Yeah.
And if you have any idea what type of patients get that in hospitals.
You're gracious to ask that. We got it in, and I think we just shipped it out an hour ago. Well, when I left to come over here, it was going out the door because we've received national recognition for doing that very, very quickly. We're learning from that. I think I may have mentioned to you earlier that you can either give it for 6 days or 11 days. And what clinicians are finding is that the 5 days works as well probably as the 11 days, so you can use it for twice as many people. We're distributing it regionally, so we send a disproportionate share to St. Louis just because they have the most cases, but we send it to every region. That's the distribution model we chose to go with. And what we're finding from clinicians is that the earlier you use it in people who are severely ill, the better they do. So it doesn't work as well for somebody who's been on a ventilator for 3 weeks, but it works pretty well on somebody who just went on one or is early in severe disease. I think the bottom line is, having practiced for 30 years, it's been our goal to let the clinicians, the doctor at the bedside taking care of your grandfather, grandmother, or whoever, to use their discretion, their clinical judgment on how that medicine is best used. And I feel really good about that here in Missouri, is that we've not been bureaucratic about it or tried to be heavy-handed. We've said, look, you're the doctor, that's your patient, you use your best clinical judgment. Thank you for the question, though.
Yeah, Mr. Williams, are you aware of any outbreaks in local jails at all?
The only one that I was aware of that I was very concerned about was St. Louis County, working with Springs Schmidt. I know about 7 days ago, she was concerned. I don't think they had an outbreak, but she wanted to do surveillance testing, and so we sent her 600 tests, and they were supplying 600, and that was about 8 days ago, I think. Time kind of runs together now, but that's the only one that comes to mind. And then I think in Lincoln County, we had a situation as well. Those are the two that I remember. But going forward, one of the things I've told the county commissioners as they look to spend their CARES Act funding is that we are very much going to be interested in all our jails that are usually run by the county to do surveillance testing, Sentinel testing, going forward. The periodic, just to check staff and guards and inmates as an early warning system. So that will change.
Okay. My understanding is that Sentinel testing is not covered by insurance. So is the $135 million going to cover the cost not only for the test, but actually on the patient side?
Yeah, I think that's all evolving. It's a preventative test, and so usually insurance will pay for a preventive test because they save money if they can catch things early. Now, to your point, I've heard, now that we're kind of coming out of the acute phase, different insurance companies are saying different things, and so we'll have to see how that evolves. But in the immediate future, we have both the $135 million from the federal government for testing that would be available to us, and we have the CARES Act funding that has to be spent on COVID-19 activities that would be available at the local level. To your point, what if this is an issue a year from now or a year and a half, and we're very much already thinking ahead of what Sentinel activities would look like after those funding streams might not be available? We're thinking about that. So I don't have an answer for you, but we are thinking about it.
Can you give us kind of a, you say you're going into different places next week. Can you give us kind of a breakdown on what counties and what sites you're going into?
I can. We're going into 28 counties in our state operated facilities. So those are all our veterans homes, our prisons, or at least many of our prisons, and all of our behavioral health facilities. So those are in 28 counties. Then we're going in and doing our surveillance testing, and make sure I get this right, in Jackson, St. Charles, Jefferson, Greene, Cape Girardeau. We'll be in Andrew tomorrow. We're going to be, I think, in Pemiscot, New Madrid, and I'm leaving one out, I know. I feel like, oh, Boone, I'm sorry, that's it. We'll be in all those counties doing surveillance testing. And the reason you would say, why did you pick those counties? Well, we've already done 13, as the governor just said. We did those about 3 weeks ago. Had 9 positives out of 3,000. And we're going to be doing some more extensive testing in Perry County next week around something else. So, and Perry County just did surveillance testing about 3 weeks ago. But those areas represent 2 things. One, they're regional. So it's important. You don't have to live in the county to get your test in those areas. So we picked Cape Girardeau because it's a hospital hub that a lot of people from the surrounding counties would naturally go to for testing. Same thing with Springfield. Springfield has a catchment area of about 20 counties where people go, oh gosh, I'll go to Springfield and get my test if I live in Webster County or one of the Polk County or one of those counties. So it's important to understand that even though they're in those counties, the testing is intended to be regional. You don't have to live in the county to get the testing for the surveillance. And the other thing was those counties had reached out to us and said, look, we'd really like to do robust testing. So that's that.
I didn't quite catch the first daily goal for boxing testing, but regardless, I don't think they altogether add up to 7,500 per day. So is the gap private labs? Is that what fills that gap, or?
Oh, I'm sorry. Yes. Right now in Missouri, we're doing about 3,500 to 4,000 tests, just clinical tests. That's people having preoperative procedures where they're doing a test or they're going in and the doctor's doing the test to make a diagnosis, that kind of thing. So right now, what I call clinical, doctors just doing them, is about 3,500. We will be layering on that about an additional 4,000 that's very purposeful, very strategic, and incredibly helpful. So again, I will say to all those patients, thank you for willing to do that. I think if you look at the places we've been, I've been overwhelmed personally as a clinician how much it's meant to go into parking lots and put up mobile testing sites. There's really an eagerness to get that. And again, just want to thank all our veterans at Memorial Day and thank the governor who's a veteran, and hope everybody has a safe and good Memorial Day. Thank you.